Welcome, future doctors. If you're gearing up for your exams, you are in exactly the right place. Today, we're diving into a high-yield explainer that's going to help you absolutely master the first group of superficial fungal infections. Let's do this. So here's our game plan. We're going to start with a quick classification, just to get our bearings. Then we'll do a deep dive into 3 mycoses you absolutely have to know: Tinea Versicolor, Tinea Nigra, and Piedraia. And of course, we'll wrap it all up with a quick-fire review to make sure those key facts are locked in for exam day.
Okay, first things first. Before we jump into the specific diseases, let's build a solid foundation. You've got to understand where these infections fit in the grand scheme of mycology. It makes everything else so much easier to remember.
So what do we even mean by superficial? Well, it's pretty straightforward, but it's a crucial distinction. We are talking about fungal infections that are completely confined to the outermost, dead, keratinized layers of the body. Think the very top layer of the skin, the stratum corneum, plus hair and nails. The key takeaway? They do not invade deeper living tissues. Remember that.
All right, let's get into our first major topic, Tinea Versicolor. This one is an absolute classic. It's super high yield, which means it is almost guaranteed to show up on your exams, and you'll definitely see it in the clinic.
Take a good look at this picture. This is the hallmark presentation of Tinea Versicolor, which, by the way, you might also see called pityriasis versicolor. See those patches? Notice how some are lighter, hypopigmented, and some are darker, hyperpigmented than the person's normal skin. That's actually where the name versicolor comes from. It means changing color.
Okay, let's break down the must-know facts. The causative agent is Malassezia furfur. Now here's a word you have to associate with it: lipophilic. Lipophilic, lipid-loving. It loves oil, and that's your big clue as to why it pops up in oily areas like the chest, neck, and upper back. The lesions themselves are those flat, scaly patches we saw. And another key clinical feature? They're usually not itchy or pruritic.
So, how do we prove it's Tinea Versicolor in the lab? This is the part examiners absolutely love to test you on. This is where you can really shine and grab those extra points, so let's pay close attention.
Here are the 4 keys to identifying Malassezia furfur, and you can even make a little mnemonic out of it. First, a simple skin scraping gives you that classic spaghetti and meatballs look. Second, a Woods lamp exam shows a golden glow. Third, if you try to culture it, you need an oily culture with olive oil. And fourth, its urea is positive. These are your 4 go-to diagnostic features.
Let's really zero in on that first one, the microscopic finding. Why? Because it has the most memorable name and it is a guaranteed exam favorite. You absolutely have to know this one. And here it is. This is the money shot. You need to burn this image into your brain. This is that classic spaghetti and meatballs appearance you'll see from a skin scraping with 10% potassium hydroxide, or KOH. The meatballs are the little round budding yeast cells, and the spaghetti, that's the short, stubby hyphae. It's unforgettable and an easy point on your exam.
All right, moving on to our next one, Tinea Nigra. This one's a lot simpler, but its features are so distinct that it makes for a perfect high-yield exam question. Let's break it down.
Okay, here are the quick facts you need. The agent is Hortaea werneckii. It's a black, yeast-like fungus which causes that classic sign, a painless, black patch. And here's the absolute key differentiator. It is non-scaly. You'll usually find it on the palms of the hands or the soles of the feet. Just remember those key features: black, non-scaly, and on the palms or soles. Now we're going to shift our focus from the skin to the hair shaft itself. We're talking about Piedraia. The name literally means stone in Spanish, and that is a fantastic clue for what we're about to see.
This right here is a classic compare and contrast question just waiting to be on your exam. For white Piedraia, think Trichosporon Piedraia. The nodules it creates are white, they're soft, and they're pretty easy to slide off the hair. But for black Piedraia, the agent is Piedraia hortae. And just like its name implies, the nodules are black, hard as a stone, and very, very firmly attached.
So what we're looking at here just helps visualize the difference. On the left, we see the arthrospores from Trichosporon that cause those soft white nodules. And on the right, you can see one of those hard black stone-like nodules from Piedraia clinging to the hair shaft. The visual contrast is a great way to remember the difference between the two. Okay, team, let's bring it all home. We're going to consolidate everything we just covered into one single high-yield summary slide. Seriously, this is your screenshot moment. It's perfect for that last-minute review right before you walk into the exam. All right, take a moment and just soak this table in. This is everything: Tinea Versicolor, M. furfur, scaly patches, and spaghetti and meatballs. Tinea Nigra,
H. werneckii, a painless, black, non-scaly patch. White Piedra, T. Bijeli, soft white nodules on the hair. And finally, black Piedra, P. hortae, with those hard black nodules. If you can master this table, you are going to be in fantastic shape.
Fantastic work. You have just nailed the first set of superficial mycoses. But the most common, the most complex, and honestly, the most heavily tested group is still to come. I'm talking about the dermatophytes, the fungi that cause ringworm. So make sure you join us for our next explainer, where we will break down absolutely everything you need to know about dermatophytosis. We're going to cover Trichophyton, Microsporum, and Epidermophyton. You really won't want to miss it. See you then.